Hello everybody, welcome back to my channel, that is Clinical Pharmacy Practice by Dr. Ashish. And today I'm going to teach you about the clinical toxicology of arthropods envenomation. Okay, before entering into the deep of this topic, I just want to make you understand that what actually the envenomation means. Envenomation is the exposure to a poison or toxin resulting from a bite or sting from an animal such as snake, scorpion, spider, or insect, or from marine life. Means it's a exposure to a poison resulting from a bite of an animal. Like you usually you uh, heard of snake poisoning. Okay, we usually say snake poisoning, but actually it is an envenomation. Literal and correct term would be envenomation, because um, poisoning, we can't we can't deny also that poisoning is a wrong term, but the correct term would be envenomation. Okay, if you want to say snake poisoning, you can, if you want to say correct term, that would be a snake envenomation. Okay, so envenomation is exposure to a poison or toxin resulting from a bite or sting from an animal such as snake, scorpion, spider, insect, or marine life. Okay, we are discussing about arthropods envenomation. Okay, so arthropods envenomation, if we want to know, then we should know what is arthropod. You must be knowing about arthropods from your school life, because arthropod, I think in biology in 10th only you have heard about arthropod, phylum arthropods, and there are many classes under arthropods. Here we will just understand what is arthropod. Arthropods are nothing but invertebrates with joint legs. Okay, they are invertebrates, and they are having joint legs. Okay, they make up about 75% of all animals, major role in maintaining ecosystems. They work as a pollinators, recyclers of nutrients, scavengers, food for other animals, and all. Okay, and majorly they include spiders, ants, centipedes, slaters, etc. Arthropods are broadly divided into four major groups. That is insects, including bees, wasps, Spanish flies. Okay, myriapods, including centipedes, millipedes, arachnids, which include spiders, scorpions, crustaceans, which include slaters, prawns, and crabs. Here we will discuss about insects and arachnids only, because the envenomation from insects and arachnids are commonly found among the population. They are widely spread also, and it's a major concern of therapeutics also. To understand these envenomations, we should be knowing about their therapy, their management, and all those sign symptoms from which that envenomation occurred. Okay, so here we'll be discussing about insects and arachnids only. So what we're going to learn about bees, wasps, Spanish fly, arachnids, which include spiders and scorpions. So these are the animals, or we can't say animals, we can say these are insects. So insects and these spiders and scorpions, we will study it. Okay, now first is bees and wasps. You are very much be knowing about bees and wasps. So here's the introduction of that. A bee sting is strictly a sting from a bee, that is honeybee, bumblebee, or sweet bee. In common parlance, it can mean a sting of bee, wasp, hornet, or yellow jacket. You are very confused among what is bee, how is like a bee, how you will differentiate between a bee, wasp, hornet, or yellow jacket. So I have a picture that from that you can understand which one is the bee, which one will be the wasp. Like here you can see, this is a honeybee. It is very common. Honeybee is very common, and this one is paper wasp. Okay, some slight differences in their structures is there. Okay, and here you can see a hornet. Hornet is also very common, and yellow jacket. This yellow jacket is very ill ill-tempered. Okay, it is very ill-tempered. So you must be knowing about this yellow jacket also. So moving on towards the introduction. When a honeybee stings a person, it cannot pull the barbed stinger back out. The meaning of this line is that when a honeybee stings a person, it cannot pull out its stinger back. And the problem with that is not what the consequence of not pulling back its stinger. It leads that bee to lose its abdomen and digestive tract, because the thing is that it leaves behind not only the stinger but also the parts of its abdomen. It detaches after the stinging of the bee. The stingers detach from their body, and causing the bee to loosen its abdomen and digestive tract, muscles and nerves. So at the end of this day, the bee, after stinging, bee will lose its abdomen digestive tract, and it will eventually make that honeybee to be killed. So this massive abdominal rupture kills the honeybee, and honeybees are the only species of bees to die after stinging. Actually, honeybee after stinging dies. There are chances that honeybee after there are very huge chances that after stinging of that uh, honeybee will die, because it will detach. The problem is that painful and sometimes fatal reaction also occurs in humans. Of various types of wasp. Now we will talk about wasp. This is the introduction of bee. Now we will talk about wasp. Of the various types of wasps, the yellow jackets are most ill-tempered. I already told you that yellow jackets are most ill-tempered and may sting without provocation. Yellow jackets are ready to sting without even giving us a provocation. The wasps and the hornets are usually non-aggressive. Wasps and hornets are not aggressive until their hive is disturbed. Means a person, if the wasp and the hornets hive is disturbed, then only the wasp and the hornets will attack. Not in other cases. Okay, but the yellow jackets can harm you anytime, whether you are disturbing their hive or not. The stinger of the wasp does not have barbs and hence can easily be withdrawn and reinserted. The problem with the wasp, the problem of the honeybee with the stinger is not happening in the wasp, because the wasps, in the case of wasp, the stinger of the wasp does not have barbs. They don't have barbs, and hence can easily be withdrawn and reinserted. The only thing you have to just remember is that after the stinging of honeybee, honeybee will be dying because of the attachment of that stinger, and this is not in the case of wasp. So wasp cannot die after stinging their host. Okay, now we will move ahead. This is the picture. You can watch it. Honeybee. This is paper wasps, and this is hornet, and this is the yellow jacket. Okay, now what are the active principles in that, active chemicals in their venom? The bee venom contains dopamine, histamine, neurotoxin enzyme, and toxic peptides. Okay, and wasp venom in addition contains serotonin and kinins. Okay, and the ant venom, though we are not studying here, contains alkaloids and solanopsin A and proteins. Actually, we are not studying ants, but I mentioned here so that you can know, you can just understand for your sake of your knowledge. I just put it here. Ant venom contains alkaloids, solanopsin A and proteins. The treatment of this envenomation by bee or yellow jacket, hornets, okay, and these all wasps, okay, will be the same. And ant also, what the envenomation by ant or fire ants, you must be knowing about fire ants, is the same. The treatment with the bee, wasps, and yellow jacket and the ant are same. Okay. Now the sign symptoms. After the envenomation of bee, wasp, and ant, you will patient will feel locally pain, itching, redness in that area. There will be a slight swelling in that area. Okay, if the stinging of that bee, wasps, and this yellow jacket occurs at the mouth region, throat, and sometimes of the face, neck, or upper limb, can lead patient to enter into the edematous phase, like it will cause them to have edema of the larynx or pharynx and will cause obstruction. Okay, locally it will cause pain, itching, redness, and slight swelling of that area. But if they upper limbs, if they means what we can say is that if the stings of that bee, wasp, and yellow jacket occurs at mouth, throat, and face, neck, and upper limb, it can lead towards the edema of the larynx or the pharynx or the obstruction. It will cause obstruction also. Then, what are the systemic reaction? Systemic reaction occur due to the multiple stinging. Means in the case of bees, wasps, and all those insects, including ants, mostly the local reaction will occur. But in the case of multiple stinging of by these organisms, the systemic reaction will also occur. It will only occur, the systemic reaction only will occur due to the multiple stinging. Okay, and what it will lead? It will causes a GIT disturbance, that will be NVD, that is nausea, vomiting, diarrhea, sweating, bronchospasm, hypotension, shock, and unconsciousness. Okay, now if local reaction and systemic reaction proceeds, then it will lead to anaphylactic reaction, that is an emergency situation. And in anaphylactic reaction, what the patient will be experiencing: nausea, vomiting, diarrhea, urticaria, swelling, tachycardia, hypotension, respiratory distress, faintness, and unconsciousness. Okay, first it will cause local reactions like pain, swelling, and all those things. But if the multiple stinging occurred, then it will lead towards the systemic reaction. It will cause GIT disturbance, bronchospasm, hypotension, sweating, shock, and unconsciousness. If the patient enter into the emergency condition of anaphylactic reaction, then he would be experiencing nausea, vomiting, diarrhea, urticaria, swelling, tachycardia, and all those hypotension, respiratory distress, faintness, and unconsciousness. All those cardinal signs and symptoms of anaphylactic reaction. And you already know what is the choice of treatment for anaphylactic reaction. Okay, what will be the treatment? The primary treatment would be a tourniquet application. Okay, tourniquet is applied proximally to the site of the sting and incision is given. The sting is located and removed by scraping or using the tweezers. These are the devices from which scraping is done and the sting is removed. Ice or cold packs can also be applied. It can relieve the local area of the patient from it will give a relief from that feel burning sensation and feel and can relieve the pain also. So, and second step will be the area is then cleaned with soap and water along with the tincture of iodine or local application of antihistamine or hydrocortisone cream is also useful. So second step will be the area should be cleaned with the soap and water, and we can apply tincture of iodine, okay, or local application of antihistamine or hydrocortisone, so that you can relieve the allergic situation as well as the inflammatory situation by hydrocortisone. Allergic situation can be healed by antihistamines, and inflammatory situation can be healed with the help of hydrocortisone. Adrenaline is a choice of drug for systemic reaction, and most probably for uh, most, what I can say, more not most probably, adrenaline is the choice of drug for anaphylactic reactions. Okay, so always remember adrenaline is a choice of drug, especially to combat systemic reaction, and it is a choice of drug for anaphylactic reaction. So if the patient is suffering from systemic reaction by multiple stinging, just don't think and watch. Just apply and give IV adrenaline to combat that systemic reaction, so that you can make the patient do not enter into the anaphylactic reaction. Okay, for feeling of pain and these all those sensation can be relieved with the help of calcium gluconate. Local swellings and all those things can be relieved with the help of calcium gluconate, 1 to 2 gram IV. Glucocorticoids can help in urticaria also. We already studied that urticaria is a sign and symptom of anaphylactic reaction, and moreover artificial respiration can help when the patient can, if the patient enters into the uh, systemic reaction as well as the anaphylactic reaction, then bronchospasm occurs in systemic reaction, as well as you can see there is a respiratory distress in anaphylactic reaction. So if we give glucocorticoid, it can relieve these two, systemic reaction and anaphylactic reaction, can relieve, the patient can have relief from these two situations. Okay, tetanus immunization is recommended. Tetanus immunization is recommended in the case of envenomation from bee, wasp, or hornets bite. Okay, that's all for the bee wasp. Now we will learn about Spanish fly. Uh, Spanish fly, I think you're not knowing about the Spanish fly. Spanish fly is also commonly known as a blister beetle. So, what uh, what is a Spanish fly, and what is the uses of Spanish fly? Actually, uh, the problem is that that we even not heard about Spanish fly, because the thing is that it's have some uses in Chinese medications, as well as Chinese system of medicine. So now we will be knowing about Spanish fly in this introduction only. So just focus on that. The Spanish fly, or we can say blister beetle, is 2 into 0.6 centimeter in dimension. The powder of that dried body is a grayish brown and contains shiny particles. Actually, the after burning this Spanish fly, that insect, okay, it will give us a powder, okay, that will be used as an aphrodisiac. Aphrodisiac. Okay, what is aphrodisiac? Aphrodisiac is a powder which helps to stimulate our sexual desires. Okay, so in Chinese therapy, it enhances the sexual desires of male and females. So this is a Spanish fly, you can see a Spanish fly. This Spanish fly is burned, and the powder which we receive from this Spanish fly is used as an aphrodisiac. Okay, so it is, what is aphrodisiac? Aphrodisiac is uh, a substance which stimulates our sexual desires. Okay, so it is, after burning that Spanish fly insect, is used as an aphrodisiac. Okay, and that the powder which we get from burning that Spanish fly is also called as Spanish fly only, just same as that, no other name. And poisoning is reported very rarely. Very rarely the poisoning is reported, and it is also used as a stimulant for scalp hair growth. I haven't heard about the hair oil from that Spanish fly, but I think they would be using in their. I think they might be using the Spanish powder in Chinese therapy. Okay, so you know about Spanish fly to this. Now we will progress further. The active principles here are cantharidin. This is the main compound which is used as an aphrodisiac, as well as in hair oils and all those things. Okay, Action. What is the action? If it is applied locally, it will cause irritation. It is an irritant, as well as it is a nephrotoxic agent. That's why if we use as an aphrodisiac, and if the poisoning occurs due to the aphrodisiac powder, that Spanish fly powder, it will after the ingestion it will lead towards the nephrotoxicity. So the signs symptoms will occur like that only. How the absorption occurs takes place. Cantharidin is readily absorbed, very easily absorbed from all the surfaces, including skin. It is very highly absorbable substance, so it can be absorbed from all surfaces, including skin. What are the signs and symptoms? Externally, on application of the skin, it causes a redness, burning pain, and the product is followed by the formation of vesicles. Okay, it will cause redness, it will cause burning pain on skin, as well as it causes to form of vesicles. Okay, when patient ingest as an aphrodisiac or aphrodisiac poisoning, or if he or she takes the toxic dose of that Spanish fly powder, it will cause a burning sensation in the mouth, throat, abdomen. It will cause them nausea as well as vomiting of blood stained material. Okay, he or she will be experiencing pain in abdomen, severe thirst, tenesmus, and difficulty in swallowing as well as in speech. Later, a dull pain is felt in the loins. There will be a desire to micturate, always want to feeling like if they are having a urination, but they are this is just a feeling. But urine is scanty and blood stained. Urine used to come scanty as a blood stain. I already told you that this is a nephrotoxic agent, and it will lead towards the urine is also blood stained. So it is a nephrotoxic agent. Here we can understand by this line only. Priapism in males. Abortion in pregnant females may occur, as well as the patient can suffer from convulsions, coma, and eventually, if the toxicity is very more and the patient is not treated or managed, it can lead towards death also. Okay, and what is the fatal dose? Fatal dose is 15 to 30 mg of cantharidin or 1.5 gram of powder. Okay. Fatal period is 24 hours. If the patient is not treated within 24 hours, he will die if it exceeds more than 1.5. Okay, what is the treatment? Treatment is very simple. If the patient is poisoned by this Spanish fly powder, then the patient should go under the gastric lavage. Demulcents for because it will cause irritation in mouth, pharynx, and all those things. To prevent that, demulcents should be given. And third one will be symptomatic treatment. Symptomatic treatment will be very simple. If the patient is experiencing based on external or ingestion, externally or internally symptoms, based on that only you have to treat that patient. Okay, this is all for Spanish fly. Then we'll move further towards the scorpions. Actually, arthropod consists of many insects and many things, many animals are there. So to learn all those things, it is very impossible. That's why we are focusing towards only the common ones, and that too also very huge. And all those things to cover, it will become a very difficult task. So okay, now just focus on scorpions. Scorpions, bichud, as you all know. Introduction. There are 100 species of scorpions that are found in India. These are 8-legged arthropods, and the end part of tail has two poisonous glands and a sting. This tail, this particular tail, have the venomous thing. This particular tail, and they have the poisonous gland over here in their tail. They has two poisonous gland and a sting. Okay. The fatal cases have been reported from Maharashtra, Bihar due to acute pulmonary edema. Okay, now we already know that fatal cases often occurs due to the acute pulmonary edema that is caused by in Indian red scorpion. It means the Indian red scorpion is more common than black scorpion. Maharashtra and in Maharashtra and Bihar, people usually come with the cases with these red scorpion bites. Okay. What are the physical properties? The venom is very clear, colorless, proteinaceous tox albumin, having hemolytic and neurotoxic effect. It causes hemolytic effect as well as neurotoxic effect. Always remember, it has the hemolytic as well as neurotoxic effect. Its toxicity is more than that of snakes, but only small quantity is injected. Actually, uh, the toxicity of scorpion is more than that of snake, but the main thing and the very good thing that the patient is experiencing or had got a bite from a scorpion usually gives only small amount of or injects only small amount of venom inside the patient, not the huge amount. The good thing is this with the scorpion, but yet toxicity from a scorpion bite is also very fatal. But the fact is, it is toxicity is more than that of snake, but only small quantity is injected by scorpion. Okay. What are the actions? The venom is a potent autonomic stimulator. Okay. It is a potent autonomic stimulator, resulting in the release of massive amounts of catecholamine from adrenaline. It also it has also some direct effect on myocardium. Okay, we already heard that hemolytic effect is there. Okay, and neurotoxic effect is there. Now we come to know about that it causes the stimulation of autonomic system and predominantly the adrenergic system or sympathetic system by this release of this neurotransmitter catecholamines from adrenaline, and it has also has effect on myocardium that we can say is a myocardium toxicity. Okay, what are the signs symptoms? Sign symptoms are local effect. First, we will understand what is the local effect. Local effects will be the little swelling over that area, prominent radiating pain. Okay, patient will be experiencing radiating pain, reddening, paresthesia, and hyperesthesia. Okay. Uh, what are the local effects? Little swelling, prominent radiating pain, reddening, paresthesia, and hyperesthesia. Okay. What are the systemic effects that involves? Nausea, vomiting, restlessness, fever, headache, giddiness, blurred vision, abnormal eye movement. There will be a profuse sweating, salivation, lacrimation, rhinorrhea, slurred speech, muscle fasciculations, jerking and shaking, which could be mistaken for seizures, slow pulse, cyanosis, convulsions, coma, respiratory depression, and the death can occur from pulmonary edema or cardiac failure in children. Okay, there are huge systemic effects that the patient will experience. Then the problem occurs how to remember that. So we will just focus on the main and which are the we will focus on the which are we will be focusing on the symptoms which can complicate the case. We will remember that features first. Okay, now the complications are tachycardia, hypertension, arrhythmias, hyperthermia, rhabdomyolysis. It will cause a nephrotoxicity. Afterwards, acidosis. It will also cause nephrotoxicity. Okay, so remember first these complication features, or you can understand that. Okay, tachycardia, hypertension, arrhythmias, hyperthermia, rhabdomyolysis, acidosis. Rest all you can add up, like nausea, vomiting, fever, okay, abnormal eye movement, blurred vision, okay, then sweating, salivation, lacrimation, rhinorrhea, slurred speech, muscle fasciculation, okay, jerking and shaking, okay, respiratory depression also occurs. Actually, the problem is that it's again it will start like nicotine. It will start with parasympathetic. It will start with sympathetic system, and it will lead towards the parasympathetic system. So it is very easy to understand if you already learned about tobacco poisoning. So it will cause a autonomic stimulation. Here is a word that we come to know, that autonomic stimulation. What does the autonomic stimulation means? Autonomic stimulation means it in ANS both the system comes, sympathetic and parasympathetic system. So by these clinical features, we already understood that first it will cause sympathetic system to activate, and finally it leads towards the parasympathetic nervous system, the activation of parasympathetic nervous system. So how will you how will you make you understand, or how will you memorize that? It is very simple. First, you know tachycardia, hypertension, okay, these are the signs and symptoms of adrenergic system activation, okay. Then rest are like salivation, sludge, you already understood. S for salivation, L for lacrimation, U for urination and all, okay. D, G, E, you know already these things, sludge. And in sludge, if you add muscle fasciculations, you already heard, and paralysis also. And these things, if you are um, learning by this way, it is very easy to understand. So add sludge, then muscle fasciculation and paralysis. Then along with that, add sympathetic nervous system clinical features like hypertension, tachycardia, vasoconstriction, and all those things, and the tremors and seizure, the complication, okay, of adrenergic system. Okay, so these you can add with that. So it is easily to be memorized, these clinical features of scorpion, right? So complication, again I will just make you understand that. Always remember tachycardia, hypertension, arrhythmias, hyperthermia, rhabdomyolysis, and acidosis. You have to make your patient to be in controlled levels of these phases so that they cannot enter into this. Monitor the vital signs and make them to control their vitals so that they cannot enter into tachycardia, hypertension, arrhythmias, hyperthermia, rhabdomyolysis, as well as acidosis. What is the treatment? The limb is immobilized and a pressure bandage is applied proximal to the site of sting. Okay. Immobilization technique is applied over here, and pressure bandage is also applied towards the proximal to the site of sting. Then the use of potassium permanganate, weak solution of ammonia, as well as or borax. You can use weak solution of ammonia, borax, or potassium permanganate can be used for washing that area. Okay, the site is incised and washed with the help of weak solution of ammonia, borax, or potassium permanganate. Prazosin therapy is very famous in that scorpion poisoning. Okay, what is the dose for prazosin? Prazosin is 30 microgram per kg per dose, like for 1 mg for adult and 500 microgram for children. Is given orally, and then after 3 hours till extremities are warm, dry, and peripheral veins are visible. Okay. Now, the very important thing, scorpion anti-venom. Scorpion anti-venom, or SAV, is specific antidote to scorpion venom. SAV against the red scorpion is available in India. Recovery is better by simultaneous administration of SAB and prazosin compared with prazosin alone. Okay, the thing is that red scorpion is very commonly found in India, and they are very easily available in all those forests and forest areas, and as well as if the garden areas is there. So red scorpions are very common in India. So for the red scorpion, we have anti-venom, SAV, we call scorpion anti-venom. And what is recommended is that uh, give scorpion anti-venom with prazosin, and it is got a good efficiency. But if you use prazosin alone, it do not give you a good result. Okay, calcium gluconate again for pain, cramps, and edema. It gives relief from pain, cramps, and if there is edema anywhere. So give calcium gluconate 10 ml of 10% solution, slow IV for pain, cramps, and edema. We give barbiturate chlorpromazine to sedate the patient because jerking usually occurs, to sedate and control that jerking. Okay. Uh, Next will be atropine. Atropine is the universal antidote that you already know. Atropine to prevent pulmonary edema. Okay, if the patient is not having a relief from calcium gluconate in the for case of edema, you can use atropine. Then rest if any other symptoms which cannot be cured by these serum, antivenom, prazosin, barbiturates, calcium gluconates, atropine, you can already you can give another symptomatic treatment according to that symptom also. So that's all for scorpion. Now coming towards the spider. Spiders. Spiders are very common in our household areas and domestic areas. However, these domestic spiders are not poisonous, and the poisonous spiders are usually found in the forest areas only, like the brown recluse, you can see here, and black widow, as well as tarantula. These all three spiders are there in our forest areas. These three spiders are very common in India as well as in other areas also, like United States and all other countries also. Talking about spiders, spiders are common like black widow, recluse, brown recluse, and tarantula. What are the common names? You just heard about this common. What are the specific scientific name? That is Leptodactys for widow spider, Loxoscalis for brown spider, and tarantula you all know. Okay, now I will skip this introduction. You can study later. Now we will move towards the mechanism of toxicity. What is the mechanism of toxicity? If we talk about the black widow spider or brown spider, what is the mechanism of this toxicity? Okay, spider use their hollow fangs to inject their venoms. They use their hollow fangs, which contains various proteins, polypeptide toxins that appear to be designed to induce rapid paralysis of their of their particular victims and aid in digestion. Okay, in the case of black widow spider, the spider venom contains alpha latrotoxin. What it contains? Alpha latrotoxin. In the case of black widow spider, that is Leptodactys, their venom contains alpha latrotoxin, which causes opening of non-specific cation channel. Non-specific, it can open any of the cation channel. Okay, leading to an increased influx of calcium. Okay, and indiscriminate release of acetylcholine at the motor end plate as well as norepinephrine. It's very toxic, Means it can open the cation channels of any area, any part of that body, and it will lead towards the increased influx of calcium, as well as it will also aid in releasing of acetylcholine, that too also at motor end plate, and as well as norepinephrine also. But in case of brown spider, venom contains a variety of digestive enzymes and sphygomyelinase D, which is a cytotoxic and chemotactically attract white blood cells to the bite site. Okay, it is a chemotactic agent also. The venom of that brown spider, that is Loxosceles, have some digestive enzyme as well as sphygomyelinase D, which is a cytotoxic, which kills the cells, as well as it chemotactically attracts WBCs to the bite site, and also has a role in producing systemic symptoms such as hemolysis. It causes hemolysis also. What occurs in toxic doses? Spider venoms are generally extremely potent toxins. I already discussed that they are very potent toxins. Means if you just see it here, they release a calcium, non-specific cation channel. They can open, they can increase. They have the increased influx of calcium. Acetylcholine, they also release at motor end plate, as well as norepinephrine. Means whole autonomic stimulation occurs. Both the just imagine both the systems activating at the same time. It will create a chaos, really. And generally extremely potent toxins, far more potent than the most snake venoms. Just, I cannot believe, just see this. Spider venoms are generally extremely potent toxins, far more potent than most snake venoms, but the delivered dose is extremely small. Look, the problem with that spiders and as well as scorpion is that they deliver or inject their venom or poison in small doses, and that is the reason that they are not as much fatal as snake bite. But it doesn't mean that their venoms are not potent toxins. They are more potent than snake venoms in the case of scorpion as well as in the case of spider venoms. The size of the victim may be an important variable. Clinical features. Now we'll move towards clinical features. For black widow spider or Lectrodectus, we can see a local signs, that is mild erythema, like mild redness. Okay, and we can see inner blanching also, an outer erythematous ring. Okay, the bite is often initially felt as an acute sting, but may go unnoticed. The site almost always become painful within 30 to 120 minutes. Within 120 minutes or 30 to 1 minute becomes very painful. For 3 to 4 hours, the cramping occurs and muscle fasciculation starts. And it involves the whole extremities. Okay, the cramping progresses centripetally towards the chest. Now it flows. The cramping flows towards the chest area, to back area, to abdomen, and produce a broad-like rigidity. It causes the chest area, back and abdomen region very rigid. Weakness occurs, dyspnea, headache, and paresthesias. Widow spider envenomation may mimic myocardial infarction or an acute surgical abdomen, but symptoms can wax and wane and often persist for 12 to 72 hours. Means symptoms can go on and off and be persistent also for 12 to 72 hours. Just imagine if the patient is suffering from this black widow spider bite envenomation, and if the patient is suffering, just imagine that 12 to 72 hours the patient is suffering from these symptoms only. So very unbelievable things. Additional common symptoms may include hypertension, regional diaphoresis, particular area sweating, profuse sweating, and restlessness, can occur nausea, vomiting, tachycardia also. Other less common symptoms or very rare symptoms occurs like leukocytosis, fever, delirium, arrhythmia, paresthesias, rarely hypertensive crisis or respiratory arrest. So how you will means make these symptoms to be memorized very easily. It's very just common thing in that spiders as well as in scorpions are they activates or stimulate both the systems autonomic. So include all uh, both these systems clinical features like first right adrenergic system activation clinical features, and secondly you write parasympathetic system activation clinical features, and also involves two three things like painful cramping occurs and it will flow towards the chest, back, abdomen, and it causes rigidity, weakness, dyspnea, headache, and paresthesias. Just include this only. That's all you can need. Okay. Now, if we move towards loxoscales, it causes cutaneous loxosalicyllum or necrotic arachnidsm. Like it causes a slowly healing skin ulcers syndrome. Like means they can cause a skin ulcer where it bites. Locally, it causes a skin ulcer that is very slowly healing. That's why the syndrome we used to say cutaneous loxosalicylism or necrotic arachnidsm. Okay, just remember this cutaneous loxoscalism or necrotic arachnidsm. For slowly healing skin ulcers occurred locally at the site of bite. Now, envenomation usually produces a painful burning sensation at the bite site. Okay, 10 minutes but can be delayed. Over the next 1 to 12 hours, a bull's eye lesion, like a bull's eye lesion forms, consists of blanch ring enclosed by a ring of ecchymosis. The entire lesion can range from 1 to 5 centimeter in diameter. Overall, 24 to 72 hours it takes. Necrotic ulcers develop. That only they are telling. Systemic illness may occur in 24 to 48 hours and does not necessarily correlate with the severity of the ulcer. Okay, the systemic manifestation can occur like fever, chills, malaise, nausea, myalgias, and rarely intravascular hemolysis and disseminated intravascular coagulopathy. These are the rarest. For loxoscaly, you have to memorize and include systemic manifestation also like fever, chills, malaise, nausea, and myalgias. Other spiders, bites from most other spider species are minimal clinical consequences. They don't. They are at the minimal clinical consequences only. They just have mild to moderate systemic symptoms like myalgia, arthralgia, headache, nausea, vomiting, and that too can be treated with a symptomatic treatment only. What is the diagnosis? Diagnosis is usually through specific levels. If have serum toxic detection is there, then it will be okay. But in the case of Indian hospital, you don't have serum toxin detection, and it they usually try to have a clinical finding rather than to have a laboratory toxin detection. And Indian hospital don't have that devices also to detect the serum toxin detection because the cases usually comes very low. That's why hospital don't contain these type of toxin detection things. Other useful laboratory studies in the case of lectrodectus, you can go for electrolytes testing, calcium, glucose, CPK levels, ECG in case with chest pain. In the case of loxoscales, you can go for CBC, BUN, creatinine, and if hemolysis suspected, haptoglobin, globin, and urine dipstick you can take. Positive with free hemoglobin are useful. Repeat daily for 1 to 2 days. Now, what is the treatment? Always, if you write a treatment, always make sure that you write first emergency and supportive measures, because emergency and supportive measures should be kept at priority levels. So, what are the emergency and supportive measures? General: cleanse the wound and apply cool compresses or intermittent ice packs. Treat infection if it occurs. Give a tetanus prophylaxis. I would suggest you that in the case of any envenomation by a animal bite, whether it is a poisonous snake or spider or anything, scorpion, bees or wasps, just give tetanus prophylaxis. It is better to give tetanus prophylaxis. Okay, so in every case you have to give tetanus prophylaxis first. Okay, you have to clean the wound and apply cool compressor intermittent ice packs. Treat infection if it occurs. Give tetanus prophylaxis if indicated. Now, Leptodectus envenomation. Monitor victims for at least 6 to 8 hours. You have to monitor because symptoms typically wax and wane, on and off. Patient may appear to benefit from any therapy offered. Okay. They can appear to be benefited from any therapy offered. Then again, maintain an open airway, assist ventilation, and treat hypertension if it occurs. Always have a patient in an open airway position, and if the patient needs ventilation, assist him a ventilation also. Treat hypertension if it occurs. Loxosceles envenomation. Admit patient with systemic symptoms only. Don't admit patient with the local symptoms. In the case of Loxosceles, I think Loxosceles appears at the low levels of envenomation in comparison to Leptodectus, because I think Leptodectus envenomation is more potent than Loxosceles envenomation. Okay, however, you have to admit the patient with systemic symptoms. Okay, and monitor them for hemolysis and renal failure and other complications also. The usual approach to wound care in the case of necrotic arachnidsm, as you already know that necrotic arachnidsm is a slowly healing ulcer caused by the bite of Loxosceles, is a watchful waiting. You have to watch it so that you can understand the envenomation is done by Loxosceles species or Leptodectus species. If it is a classical sign for Loxosceles envenomation is that it causes a necrotic arachnidism. So it will be a watchful waiting so that you can watch the patient and understand the envenomation is done by Loxosceles or Leptodectus and treat according to that particular species envenomation. The majority of these lesions will heal with minimal intervention over the course of few weeks. It takes time, but it heals slowly only. The standard wound care measures are indicated. It's very important. Secondary infection should be treated. Antibiotics should be given. In the case of any bite, antibiotics should be given as well as the tetanus immunization should be done. Surgical debridement and skin grafting may be indicated. Maybe for large or very slowly healed wound, it's better to do surgical debridement. And however, prophylactic early surgical excision of the bite site is not recommended. Prophylactic early surgical excision is not recommended. Don't always just go for surgical excision. Make the patient to have antibiotics or secondary treatment you can give. Secondary infection you can give antibiotics or not. If he or she needs surgical debridement, if it indication is there for surgical debridement, then only allow them to have that. What do we have specific drugs and antidotes? For Leptodectus patient, most patient will be benefited from opioid analgesics. They will be benefited from opioid analgesics such as morphine to control pain. For muscle cramping, it treated with intravenous calcium, as you all know that calcium gluconate is there, or skeletal muscle relaxants such as methocarbamol. For muscle cramping, we have 2-3 things. In the case of arthropods poisoning or arthropods envenomation, in the case of pain and cramping, what we give? Calcium gluconate. Always remember. In the case of poisoning or envenomation by a bite, if it causes pain as well as cramping, we give IV calcium gluconate. Here also, in the case of muscle cramping, we will give intravenous calcium. However, they have not written calcium gluconate, but I must tell you, use IV calcium gluconate, or skeletal muscle relaxant. You can use methocarbamol. Both are correct. These therapies are often ineffective when used alone. They are very ineffective when they are used alone. Like if you use only intravenous calcium gluconate only, don't use other therapies, only use calcium gluconate or methocarbamol. So it will not be effective. Anti-venom is rapidly effective. We have anti-venom also for this spiders also. Is rapidly effective but infrequently used because symptomatic therapy is often adequate and because small risk of anaphylaxis. The problem is that antivenom is also present for lectrodactus bite, bite envenomation, but the thing is that lectrodactus envenomation is treated or managed with the help of symptomatic treatment and is well treated, and the patient is very the patient is very benefited by these therapies, and they don't need anti-venom for that. So anti-venom, there is the problem with the anti-venom is that actually the symptomatic therapy is often adequate. The problem is that if there is always a risk of anaphylaxis, so why to give anti-venom for that if the patient is having the benefit from that symptomatic treatment? So we often do not use anti-venom for lectrodactus species. However, they are available. It is indicated for seriously ill patients only, and elderly or pediatric. Seriously ill, elderly or pediatric patients who do not respond to conventional therapies. Actually, the patient who doesn't respond to conventional therapy of hypertension, muscle cramping, respiratory distress, pregnant victims threatening premature labor, and these all patients who are not responding these for this are only the elderly patients, the pediatric patient as well as the seriously ill patient. And for this cases only we will give anti-venom. Okay, now loxosceles, therapy for necrotic arachnidism. The loxosceles we mainly focus towards the necrotic arachnidism. Has been difficult to evaluate because of the inherent difficulty of accurate diagnosis. However, we can use dapsone, which shows the promising effect in reducing the severity of necrotic ulcers in anecdotal cases report, but has not been effective in controlled animal models. Okay, dapsone has shown the promising effect, but it's not like that dapsone is the only choice of drug for that necrotic arachnidism, but it has shown effects in some anecdotal cases reports. Steroids are not recommended here in the case of this loxosceles. There is no commercially available anti-venom in the United States, as well as we don't have the anti-venom for loxosceles in India also, because loxosceles envenomation can be treated with the help of symptomatic treatment. So we actually don't need anti-venom for that, and even also we don't need for lectrodactus also. But in the case of severely ill patient, elderly or pediatric patient, the problem will become worsen if we don't give anti-venom, because the conventional therapy for hypertension, muscle cramping, distress, and these respiratory distress and pregnant victims, it will be difficult for them to have a conventional therapy response. That's why we give anti-venom that of lectrodactus patient. Hyperbaric oxygen has been proposed. Hyperbaric oxygen means increased level of oxygen you have to give. Has been proposed for significant necrotic ulcer patient, but results from animal study are equivocal. So this is also like dapsone only. We can't say that it is a choice of drug, but hyperbaric oxygen has shown some promising effect also. And insufficient data is there, and it doesn't recommend its use. So it's 50-50% chance that you can give hyperbaric oxygen is good, effective, or dapsone is good or effective. Steroids we don't recommend. And symptomatic treatment is the main choice of treatment for loxosceles. We can summarize that. Decontamination, and decontamination it's very common sense. We are having the common sense that decontamination won't work here because locally they will bite. and they are not uh, talking about decontamination. Only the skin washing is washing with the water on this copious saline water can take, but these measures are not applicable, and these are not the proven values we can use in the help of necrotic ulcer formation in the case of Loxosceles. So gastric lavage, don't think about, because there is a common sense. Skin, there is a bite on the skin, so we don't need gastric lavage and whole bowel irrigation. In this term decontamination, only the washing over that area is good, but that also it doesn't prove any efficacy in washing those things. Like in the case of Loxosceles bite site, to prevent necrotic ulcer formation, we don't have a proven value for washing that area. Enhanced elimination, this procedure can't be applied, common sense. This procedure not applicable. So that's all for this arthropod envenomation. I hope you will study it well and just make a smart learning technique. Learn with the help of like make a mnemonics, and learn by correlating the specifically correlating the concepts of sympathetic parasympathetic system and these all things will be easy if you understand these topics and memorize the main things which cannot be understood. So that's all for this Arthropods Envenomation. Study well, and thank you for the listening. Bye bye.